Kimberlyn Rogers.
And I'm Susie Villela with KKCSS, reporting the 6 o'clock news. Tonight our special report features an autoimmune disease not known to many, vasculitis.
Vasculitis, in basic terms, is the inflammation of the blood vessels. Each year in the United States, about 200,000 Americans are affected.
And now with us to shed more light on the subject is our Chief Medical Correspondent, Cody McMillan. Thank you for joining us.
Can you walk us through some of the signs and symptoms of vasculitis?
Of course. An individual who's diagnosed with vasculitis might incur some of the symptoms such as fever, loss of appetite, weight loss, fatigue, and some of your general aches and pains. For those unfortunate individuals who are diagnosed with more organ-specific vasculitis, such as in the skin, where they might develop hives or bumps, in their joints, where they might develop arthritis, or even in the brain, where they develop stroke-like symptoms, such as paralysis or even speech impediments.
Is there an option for an affected person to seek treatment?
Oh, of course. When you're sick, the first thing you do is go see your primary care physician. Once you've seen your primary care physician, you guys can seek out treatment options with a specialized doctor and hopefully get a wrap around this disease. To help actually with talking about treatment options for vasculitis, I brought in Dr. Sarah Castaneda to help us with some of the options for treatment. So Sarah, what are some treatment options for a person with vasculitis?
There are several treatment options for patients that do have vasculitis. For the most part, patients will use corticosteroids or immunosuppressors. In extreme cases, we do use similar chemotherapy drugs to those for cancer patients. These drugs all are meant to suppress the immune response that the body is doing to itself.
How is the outlook for patients once they begin treatment for the disease?
With the proper treatment, patients can go from having very few months to live to having an almost full and complete lifespan. It depends on the type of vasculitis and how it was induced that the patient gets. That varies the treatment options, but patients can achieve remission and will have to stay in constant communication with a knowledgeable physician in the case that they have a secondary flare-up.
Thank you, Sarah, for coming on our show and explaining the treatment options for vasculitis.
Thank you for having me.
Thank you, Sarah, for joining us. Now, to talk about how it is to live with vasculitis, I have brought patient Caitlin Mayerberry to join us. Thank you, Caitlin. What's it like to be diagnosed with vasculitis?
Well, originally when I was diagnosed with vasculitis, of course I had to go to the doctor. I didn't know what was wrong. I was always in pain. I could barely eat. I was always tired. And they were like, you have vasculitis. And that's what's causing all these symptoms. And they ended up putting me on the medication I'm on now. And thanks to them, I'm able to be a functional adult. I have a job, I go to school, and I'm able to function just like everybody else.
Thank you for your time.
Thank you.
Thank you for coming in and talking to us this evening about vasculitis.
Of course, thank you for having me.
Thank you for joining us for our special report.
And don't forget, tune in tomorrow morning at 6 a.m. with our affiliates. Good night.
Audio Jungle.